Hey everyone, welcome back to the channel. My name is Brad, and in this video we're going to be talking about hip impingement syndrome. Okay, that's something that I see in my practice quite a lot, and obviously I'm going to use my friend here to demonstrate some of the main movements that occur in the hip joint. And we're also going to be talking about which are the movements that in most cases will cause pain on the front of the hip. Without further ado, let's get into this video. You alright? When talking about hip impingement syndrome, or the actual medical term femoroacetabular impingement, or FAI, we're looking at mainly pain on the front of the hip. Okay, so I'm going to use my friend here to demonstrate where exactly most people will feel the pain. Let's get this out of the way there. There we go. So in most cases, people will feel the pain right here on the front of the hip. So that kind of anterior aspect of the hip joint. Now there's a few reasons that we're going to discuss in this video that could potentially be causing the pain here. And just remember that just because you've been diagnosed with impingement syndrome doesn't necessarily mean that you've got something wrong with the actual joint. Okay, so that's very important to keep in mind. Starting off with the joint, yes, sometimes you can have excessive bone growth, which can cause rubbing between the bones of the head of the femur and the insertion point here, the socket. Now remember that the hip joint is a ball and socket joint, which means that this kind of ball here, the head of the femur, kind of goes into the acetabulum here, and it kind of allows the movements in all different directions, which is great for the hip joint. However, if you've got excessive bone growth or there's something here restricting the movements, then these bones are going to be rubbing against each other in some of these cases, in some of these angles. When the head of the femur goes into the so-called flexion of the hip, and you get this kind of rubbing on right there. So where my finger is, you can see how the head of the femur essentially pinches my finger between itself and the pelvis there. Okay, so that's where most people will feel the pain, right in front of the hip. Now sometimes people can also feel pain a little bit more internally. So if I create the so-called figure 4 test, which is essentially placing the foot on the opposite knee, applying a little bit of pressure on the right ASIS, so essentially the opposite hip, and then pushing this knee down. Now for most people with impingement syndrome, they'll probably feel pain right there. And this pain could be because of either stretching or pushing on some of the tissues that you got around here. Now, remember I mentioned previously that this issue is not always about bones or joints. We've also got a lot of tissues that kind of cross through here. You've got muscles like the psoas major, you've got the iliacus, you've got the sartorius muscle, so there's a lot of tissues here that I am going to talk about later in this video specifically using my 3D anatomy software, but there is a lot of tissue that actually goes through this area. And not just muscular tissue, remember that we've also got the femoral artery, we've got the femoral vein, and we've got the femoral nerve that passes through this area. So this so-called inguinal triangle, which is essentially kind of here, so between the pubis and the kind of the ASIS area, and all these kind of tissues pass through this area. So this is a very congested area in general, and this is why all the time when talking about impingement syndrome, it's not just the joint or the bones that are the problems. You may be diagnosed with it because you may present symptoms of impingement due to certain tests that you can do, but it's not always about the joint itself. It could be some sort of a tissue compression because of all that tissue that's kind of gathered here. And for most people, it could be stuck because not everybody works on mobility. Not everybody creates kind of, banded distraction exercise like the ones I'm going to show you in this video. And one of the problems is that most people don't tend to optimize their hips in terms of both mobility and strength. Because keep in mind that a lot of these movements that you've got here available to the hip, like hip flexion, hip extension, adduction, abduction, and internal external rotation, those are created by muscles. And just because you have an impingement coming this way or you have pain coming this way, this doesn't mean that you should avoid doing strength training for this specific movement. Okay, so a lot of people, if I put somebody in this position and I ask them to apply a little bit of pressure going upwards towards their chest, they can hardly hold their own here. So they can only do like 2-3 seconds before I'm able to push them away. And that's not me kind of smashing their leg down. I'm just applying a little bit of pressure so I can test, the psoas major, the rec fem strength. This is one more aspect that you should keep in mind, that, mobility, stability, strength and flexibility, all these aspects of movement and rehab should be done together, and you shouldn't really be avoiding any of these just because you have local pain during a specific movement. Okay, so that's a very narrow-minded approach to rehabbing injuries, and I don't like it.
So looking at the anatomy of the hip joint, first of all, I'm going to start things off with the very deep layers of the hip, and we're going to gradually build towards like adding more muscles, so you can see exactly which tissues could potentially cause like an impingement here. What's very important to notice here is the inguinal ligament, which is this white line that, as I said, connects the SAS area here to the pubic bone here. Okay, so a lot of the like tissues that we've talked about previously pass underneath here. So if I am to add, like, for example, the nerves here, you're gonna see how they kind of pass underneath like this. As we said, femoral nerve is this here. So you can see it slightly highlighted, and it kind of passes right underneath the inguinal ligaments and the iliacus muscle here. Okay, so you can kind of trace it there. So this is, see the blue dot there, and you can trace it going down and spreading into the lower thigh. As we're gonna start adding more layers of muscles, you're gonna see how much more tissue kind of is gonna accumulate in this area here. And a lot of the time, like literally like this kind of maybe triangular shape here is where people would feel the impingement, especially when doing like hip flexion, because either these muscles are weak or there's something else going on like that's kind of stopping that movement. So keep in mind that we are talking about impingement that's caused due to muscle tissue restrictions and stuff. We're not talking about like any of the bones at the moment. And let's kind of add more muscles here. So you can see we've added like the TVA, covers the psoas muscles on the iliacus, and let's kind of keep adding more until we kind of cover the hip. So there's one more muscle that kind of covers the like the front of the femur here, and that is the rectus femoris. Okay. And we got like some more layers. We got the sartorius. Initially the hip is pretty kind of naked, you can say, and then as you start building the muscles around it, you can see how they kind of start to protect it, you know, anteriorly, like a little bit more kind of medial, and then lateral with the TFL, and that's it. We've kind of reached the maximum kind of amount of kind of tissue that we can have here. And the main muscles that I really want to focus on are going to be the iliacus, which we've saw before, the psoas major, the sartorius, the rec fem. The first exercise that I'm gonna take you through is the lying hip mobilization. So as you can see there, I've attached the band on a squat rack, and the band is there also attached onto my thigh. Now the band is attached above the kneecap. That is on purpose. Sometimes people can attach the band under the kneecap, but if you want to really directly affect the hip joint, especially on the front, literally like there, this exercise will be ideal done like this. The initial stages of this whole video I showed you the figure 4, where I put kind of the skeleton's leg across each other in like the number 4, and this exercise mimics that, and it's essentially trying to mobilize literally that specific position. And that's very important for you to understand, that we are really targeting specifically that kind of anterior hip portion where a lot of people get impingement or any kind of symptoms that relate to impingement or pain and anything like that. Okay, so working on this exercise on a daily basis can help you really alleviate any restrictions on the front of the hip. The second stage of the exercise routine is going to include 4 different band distraction exercises. You can see the first pair on the screen there, and essentially we are working on the left hand side. You can see medial hip mobilization. So I've attached the bands very deep towards my groin, and I'm creating several rotational movements with my hip, trying to really distract the hip joint, which means I'm pulling it kind of slightly outwards, which is opening up the inner portion of the hip joint there. Whereas on the right hand side, I've attached the band again very kind of close to the groin, so I can really target that anterior portion of the hip. Now this is where a lot of people will get the issue, like we've said previously. So this exact position with the added band resistance is perfect for what you're trying to achieve. And you can also see me creating different movements with my leg. So I'm trying to place it slightly rotated out, and then I rotate it in as well. And at the same time, you're creating like several movements back and forth with the opposite leg, which is creating that kind of non-stop mobilization. So this is more of a peripheral mobilization type of technique, which I've discussed in previous videos. And these two together are a great way to kind of start off the or continue the mobility sequence after the first exercise. And the second pair is going to present 2 different options for doing that. And again, we're now focusing more on the lateral and posterior aspect of the hip joint, because that's also a part of it. You know, sometimes people forget that the body is like 3-dimensional. one-dimensional. You know, it's silly as that sounds, but people do. And when you do that, you kind of neglect several kind of other aspects of the hip. So what I'm trying to do here, I'm trying to make sure that I mobilize the lateral portion of my hip joints as well as the posterior portion of my hip joints. And if you're asking yourself, like, how is this posterior, when the band is pulling the leg forwards, you are essentially applying the resistance or the pressure on the back of the capsule, whereas in the previous like variation that you saw a couple of seconds ago, the band was on the other side and it was kind of applying tension on the front of the capsule. And that's how I kind of that's where I derive my logic from. And these kind of two pairs of exercises, or these 4 exercises that you can see all on the screen now, are a great way for you to work on daily hip mobility, and can really help alleviate tension and fix pain in the long term. Thank you for watching. Please subscribe to my channel for more exercises and anatomy content. If there is anything specific that you would like me to cover on this channel, please let me know in the comments below this video. See you in the next one.